Let me show you how to do a Kegel. Welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Why do you need to Kegel? You might have been told that you need to do Kegels. Maybe you have some pelvic floor issues like incontinence or leaking. Maybe you have prolapse or diastasis or even pelvic pain. And perhaps your doctor or other medical professional has told you you need to do Kegels. Maybe you think or know that you have a weak pelvic floor. Recommending Kegels is very common in and among healthcare providers when it comes to pelvic floor issues. But you might be wondering, am I doing the Kegel correctly? How am I supposed to do it? How would I know if I'm doing it correctly? So today I want to show you how you can do a Kegel correctly and how you know if you're doing that Kegel correctly. I'm going to show you two ways. So when I refer to a Kegel, it really is a particular type of strengthening exercise in order to strengthen the pelvic floor muscles. I'm going to show you here this female model as we're looking down into the pelvis. You can see these pelvic floor muscles as we're looking in there, and they create kind of like a bowl or a sling or a hammock. What I took out were the organs that are into this space typically, your bladder, uterus, and rectum for women. So you can see that those muscles, they help to support the organs. They provide support and stability around the pelvis, as well as the whole bottom of the back, okay? So those are the deep pelvic floor muscles in there. And then if I turn this, you can see more of the superficial muscles. And we can see the vaginal opening here and the rectum there. And we can see the muscles as they come over to the side here, to the sits bones, as they cross here at the perineum, that space between the vaginal and anal openings, okay? And they continue on up here to the pelvic or the pubic bone. So when we talk about doing Kegels, it really is, how do we strengthen these muscles? How do we contract these muscles? Because they can, like I said, help to support this whole area and the organs. So if you have been told, to do some Kegels, you may be wondering, well, how do I do it? And how do I know I'm doing it correctly? So let's get started. So I'm going to give you a short version on how you can actually do a Kegel. So what I want you to do is I want you to inhale through your nose and bring that breath down. Allow your rib cage to kind of expand. Bring that breath all the way down, if you can, into this pelvic area. So if you could breathe and allow the muscles to kind of relax into this bowl or this sling hammock area. And then as you exhale, exhale like you're blowing out through a straw. The smaller the straw you make is going to help those muscles contract a little bit more, okay? Now you can't see from the outside whether or not I'm doing a Kegel, okay? So that's the hard part, is because even when I have patients that come in here and working with me one-on-one, I can't tell externally, are they doing a Kegel correctly? There's some cues I can look at external, but it doesn't really tell me as much as, say, doing the tips I'm going to tell you later. Okay, so at home, I want you to just try that. I want you to inhale, bringing that breath down all the way into here, and then exhale. Just see if you can squeeze those muscles without having to squeeze your buttocks or bringing your hips together or moving anywhere into your lower back or your core, okay? So give that a try. The next part of this video is going to be actually looking or feeling for two things to know if you're doing a Kegel correctly. So that's what we're going to get started with now. So the first thing that you can look for to know if you are doing this correctly is a wink and a nod. I'm going to explain what I mean by that. So as we're looking down below here, again, we can see the vaginal opening and the rectal opening. So if you're doing a Kegel correctly and those muscles are contracting, they're drawing in or drawing up. What you're going to find is a nod of the clitoris. So the clitoris here is at the very top of the vulva, and it's going to nod, okay, down towards the vaginal opening or move downward. And then the anus is going to wink or it's going to close down. So you can look for those two clues from the outside. So let me show you what I'm talking about. So I'm going to use my little silicone model here, and I'm just going to kind of place it, where this would be on me. And what I would suggest is that you can do this at home, sitting in your bed or in the bathtub. Get a mirror, and you can place this in front of you so that way you can see your own anatomy. And then what you can do is work on that inhale, bring the breath down into the pelvic floor, exhale, and squeeze. Just like you're trying to stop the flow of urine if you were trying to stop urinating midstream. Okay, and with that, you should then see that the clitoris nods down and that the anus closes down. Okay, so that wink and a nod. So give that a try. The second thing you can feel for clues on whether or not you are contracting correctly. So I'm going to use this model again. This one I can actually take the vulva off, okay, so that I can insert my finger here. So this is what I would suggest, is that you actually feel for a contraction, okay? So what you would do in this case is wash your hands, make sure they're nice and clean. You can use a little lubricant placed onto your index finger or onto your thumb, whatever you feel most comfortable with. But what you can do is still be in that same kind of position that I was just in, where knees are open and you're able to feel into your own pelvic floor area. Then what you can do is you can actually insert one finger vaginally. So I'm going to take the vulva off. So just imagine my finger going in vaginally. Then what you can do is you can feel these pelvic floor muscles, okay? What I suggest to women is don't just go straight in, because there's a lot of space there. And it may be hard for you to feel the muscles kind of gathering around your finger if you're just right in the middle. So what I suggest is come off to the side, so right side. And as you contract, see if you can feel those muscles contracting or gripping around your finger, kind of squeezing. Okay, so you're going to do that. Again, you're inhaling. See if you can feel the muscles relaxing. It's not a bearing down. It's more of a just relaxation. And then as you contract and exhale, you should feel some muscle movement and squeezing around your finger. And then you would inhale and see if you can relax again. Then you can just simply move your finger over here to the left side, okay? And it's not that only the muscles on the left side are contracting versus only on the right side. They're all contracting, but it can be easier for you to feel that contraction if you kind of localize one side versus the other side, okay? So that's a really good way to feel if you are doing it correctly. And if you're not feeling much of a squeeze, it can actually give you a little bit of feedback for your brain to be able to connect in with those muscles a little bit stronger and a little bit better. So it can actually be used as a way to train the muscles as well, to give you some feedback. So you came to this video to find out how to do Kegels correctly, likely driven by something that's going on with your body, right? Maybe you're experiencing, like we talked about earlier, some pelvic floor issues, incontinence or prolapse symptoms, or you feel like you have a weak pelvic floor or have been told that. I want to end this video by saying not everybody needs to do Kegels, okay? Even if, say, a well-meaning doctor or health provider has told you you need Kegels, the best next step is actually to consult with a pelvic floor physical therapist. We are trained in being able to assess pelvic floor strength as well as flexibility to really know if the muscles are at fault or if there's maybe some other areas that need to be addressed, like posture or proper breathing or prolapse management. So I encourage you, if you have further questions, if you want to know if doing Kegels is appropriate for you, or if you have questions about your particular condition, I encourage you to visit our website, healingspotpt.com, and you can reach out to our expert staff and get your questions answered. If it's appropriate, sit down with one of our expert physical therapists and let us help you, guide you into those next steps, and let us answer those questions for you so that you have peace of mind and more confidence in your body. Thanks for watching this Ed Talk. I'll see you on the next one.